October is Breast Cancer Awareness Month. SSM Health family medicine physician and wellness coach Dr. Roopa Shah is here today with reminders on what symptoms women should watch for, the current treatment options for breast cancer, and what women should know about breast cancer screening. So we're going to start with just the common signs that women should be looking for when it comes to breast cancer.
Yeah, so I always tell my patients, anytime you find any change in your breast, typically we think of if you find a new lump or a new mass in your breast, but really even if you see any skin changes, any new rashes, thickening of the skin, dimpling of the skin, nipple discharge, redness, flakiness, pulling in around the nipple, any of those signs, really you want to get in right away and talk to your doctor and get an exam.
So it can be, more than just the common terminology when we hear a lump or something like that. It can be a lot of different things.
A lot of different changes, yeah.
So can breast cancer be cured, and what does that treatment entail?
Yeah, the good news is there are a lot of different treatments, and it is highly curable in the early stages, and so that's why early detection is so important. Right. There's a number of treatments, and it really depends on the type of breast cancer you get diagnosed with. It could range from radiation to chemotherapy to hormonal treatment, but the outcomes have been really good for a lot of women in the early stages.
Well, that's really positive news. Now, what should women know when they go get screened for breast cancer?
Yeah, so the main thing is that as you approach the age of 40, you should start talking to your physician about when is the best time to start your screening. The American Cancer Society recommends starting at age 45 and doing it annually, and then every 2 years after the age of 55. But that can be really different for folks that have a family history of breast cancer, have had previous breast biopsies. So you really need to tailor that screening with your physician and talk about what the best, screening recommendations are for your individual case.
Yeah, got to keep it, kind of think about your body, your family's history. That's all such really good information. Well, thank you, Dr. Shah, as always. Now, where else can people find you?
So they can find me on Instagram at Wellness with Dr. Shah.
All right, thank you very much.
Thank you.